Okay, well, thanks very much for the opportunity to participate in this wonderful program. It's been going on for some years. Steve Shore has really done a great job of pulling a lot of information together and continues to show it. I like that idea. In any case, as you can see in my title, really has to do with trying to talk about nutrition, which has been my profession for so many years, more than 70 now. Uh, and and unfortunately, it's not generally talked about the way it should be talked about in the public. We don't talk about the right way in our own profession, and I think the medical profession doesn't either. In any case, I'm going to run through some ideas with you that based on research that I've been doing over the years that really just taught me a lot. And this is just a little bit of background for my story that I want to tell here. Uh, I had a background of working in an area that we were producing milk. I was raised on a dairy farm, milking cows, and to get that good protein. I did my doctoral dissertation later on at Cornell, and the doctoral dissertation was arranged with funding from my two co-chair professors. And it was designed. Let me start with this. It was designed to actually do a study to show how a nitrogen substance produced by DuPont Chemical Company, another one, how it might be fed to cows so to increase the production of their milk for that good protein. So it was all about encouraging protein consumption. And that was, as I say, before 1956, of course, but I'm in graduate school now. And after finishing my graduate degree in 1962, or 61, 62, I then was involved in taking a position on the faculty at Virginia Tech University, and they had a contract there. The director of the department had a contract there with USAID and in the Philippines. And my job was to organize, if I could, a so-called malnutrition program for feeding malnourished children. I mean, there was a lot of interest in the world in those days about malnourished children, still today, of course. And the idea was that these children needed to get protein. So I'm steeped in the protein story, all the way from my personal life before going to school. And then when I go to school, it's, doing a thesis on the way to increase the production of animal protein. And then, of course, in the Philippines, this is the kind of children that we had to face that just many countries around the world, poor countries, obviously, encourage protein consumption. So in any case, on one occasion, in the very beginning, I made acquaintance with a couple of physicians. One of them was the medical director of the president of the Philippines, Ferdinand Marcos. And they told me about some children, very young, 4 years of age or younger, who were actually dying of liver cancer, which I knew to be started by a compound called aflatoxin, was a mold toxin. And after we got started in doing this study and collected together our children to do the study, it turned out that few children consuming a more Western kind of diet, US type diet, more liver cancer. They told me this is what they were seeing. And I thought that was really puzzling. That's why, basically. And it's just about that time. I'm sorry, I'm getting my screen here out of order. Okay, so just about that time, I had the opportunity of seeing a paper published in 1968 from India, basically where they apparently had some impression too that animal protein could play a role maybe in increasing cancer. Really odd. That was not exactly what anybody was interested in at the time. And they published their results. As you can see here, it's really a massive effect. Animals consuming 20% of calories as protein, animal protein that is, all 100% had the early lesions or the so-called hyperplastic nodules or tumors. And the animals had the 5%, has 5% of total calories as protein. None did. I mean, 100 is enough to score. I mean, that's pretty impressive. But at the same time, not very sensible from my perspective, because I'm thinking that protein is the best thing going that we have, just like everybody else. Anyhow, sorry. Okay, so increasing protein, increasing cancer. So, and the question then for me was, since I was asked to set up this program for feeding malnourished children around the world, I came home and did some research on this at the time, and to see if it was really true that it did work, showing high animal protein consumption, more liver cancer. So here is, in fact, some of the early results that we got. I had to prove to myself that this is real, because it was really hard to do given my background. And I'm shown here in this little slide, this little scheme showing over time, the first 12 weeks, after administration of a chemical carcinogen in rats, how then when they were fed either 20% protein was more or less a normal, the high normal, or 5%, which is barely enough to survive. So the ones fed over the first 12 weeks, 20% protein, the cancers are growing well, as you can see. The ones fed 5%, not. The cancer is not growing, in spite of the fact that their genes had been mutated with this chemical carcinogen. So in other words, cancer started in these animals, but it was only growing in the animals fed to 20% protein. This is more or less what the Indian workers had done. And so then we tried something new, which I found really striking. I said, what happens if we just leave 20% for the first 3 weeks, and then 5% next 20% next 3, and so forth. And you can see we could turn cancer on and off, cancer growth. And the red bars is 20% animals that fed 20%, the 5% is the lower animals. So we could do it very quickly. And what I noticed in this research that we were doing at the time, that these effects took place in a matter of almost like hours, certainly within days. And so it was a really very striking effect of protein. What this tended to show was something that wasn't known then at that time, not to me either. Namely, it's not the genes, where the cancer starts. That's not the starting point. I mean, there's control of cancer, of course, if you stop genetic mutations. But in reality, we get exposed to mutations all the time. And what really triggers whether or not the cancer grows, in this case, was showing that nutrition, or animal protein in this case, is really what turns the cancer on. It's not the genes. The genes start it, yes, but whether or not it really grows is a function of nutrition. In this case, feeding animal protein. So then jump way ahead. I worked on this with a group of graduate students in a laboratory at Virginia Tech University. We did all kinds of things, and including this, and I'm just jumping ahead a bit, showing what happens over the lifetime of the animal. And there's one thing to see what happens early on, but in this case, these are two groups of animals. One fed 5% protein, the other fed 20%. And you can see there that at the end of their, more or less near the end of the rat's life, the ones fed the 20% protein are all dead with cancer. And the ones that fed 5%, none are. I mean, again, a very striking, really major effect of just simply animal protein. In this case, the animal protein we were using was a protein of cow's milk, of all things. So the animal protein, which is considered to be the highest quality when it comes from dairy cows, that kind of protein is really what is turning cancer on. Another shocking thing to say the least, but it was basically the same thing with the Indian workers have found. So I'm convinced, okay, it works. And then later on, some years later, just for comparison at this point in time, we tried soy and wheat protein instead of the animal protein casing. And it did not, these plant proteins did not increase cancer development, even when they're there at 20%. So here's a major difference between animal and plant protein. Animal protein, animal-based protein turns on cancer. Very striking and very sharp, and you can see it that lasts for a lifetime. Feeding the plant proteins, it did not increase these pre-cancer development, even when it's at the higher levels of 20%. So animal proteins cause cancer, and what turned out in the course of my work over the years, it causes some other things, a variety of other chronic degenerative diseases as well. and plant proteins prevent? At least that was the question that obviously I gradually came to learn because of our work. That you can see at the bottom of the publication concerning this. The first time we did this, showed the different plant and animals. So nobody wants to hear that protein, especially from animals, the highest quality protein, no one wants to hear that causes cancer. That it does, it does it in the rats in this case, but it kept me going. And the first thing that we usually need to know, in this case, at least for me, was how does this work? And is there any way that we can develop a drug maybe that could block this? So in order to tell that story, I'm showing here a schematic of the whole cancer process, just to make that point. But cancer in those days, and more or less today, it came in three phases. There's a first phase, is initiation. That's when the genetic mutation occurs. In other words, we consume a chemical, it changes the gene, and now the gene is doing its usual thing, it's capable of causing cancer. Then once it's formed, then it goes through a much longer period of time. In the case of humans, it's probably months, years, if you will, but in the case of rats here, it was over a period of the first year or so. And after it was mutated and started, then the cells started to divide. That's the second phase in promotion. And that's called promotion. That's when the cells are, as I say, are divided, they're expanding into multiple cells. And finally, it gets to a point which in terms of human cancer is a reference point, a really important one. That's when all of a sudden these cells migrate from the original primary site to some other site in the body called metastasis. And that's called progression. So this is just a generic sort of representation of the scheme of cancer as it occurs over time. In this case, it's for rats. So in order to find a mechanism that we might develop a drug for, that's what everybody was thinking, I did too, we started looking for a mechanism. We studied this process fairly carefully, and I want to show you here, this is the same chart at the top as at the bottom. At the top, we're looking for mechanisms to explain this effect in the first phase, during the initiation phase. In the bottom, we're looking for mechanisms that occur in the second phase, where you can turn cancer on and off. And so in the first phase, we started looking for mechanisms to account for this effect. And the first thing that we noticed, a high protein diet increased the rate at which the carcinogen enters the cell, into the normal cell. Wow, that's a big deal. So that 20% diets increase the rate at which these chemical carcinogens go into the body and go into the cell. And the high protein diet did that. High animal protein did that, and lower it did not. Well, so there's a place right there. I mean, in theory, we can find a drug to block the entry of that carcinogen into the cell. It can accomplish something. Now, when a carcinogen comes into the cell, that's a chemical. It comes into the cell, and of course, it causes mutations in that first stage, as you can see there. And then at that point in time, the carcinogen, in the case of cancer, generally no, the carcinogen then is metabolized by an enzyme called mixed function oxidase, MFO. This is part of the process, normal cancer. So the carcinogen comes into the cell, and then the enzyme goes to work and metabolizes it to produce a product that then binds to the gene, causes mutation, but it causes some other things too. So the mixed function oxidase enzyme is really important. So what does a high protein do? The high protein diet increased the activity of this enzyme. Basically, that activates the carcinogens to bind to the DNA. Wow, that's a second possibility. Really quite interesting. High animal protein increased the activity of the enzyme. It can increase the synthesis of the enzyme itself, make more enzyme, if you will. Now, that enzyme is very complicated, big structure, relatively speaking, big globule kind of structure of protein amino acids. In any case, the high animal protein altered the structure of this very complex enzyme in such a way that it actually increased the conversion of the initial chemical to go on to do its thing, to start promoting cancer. So what did the high protein diet do? And increase the synthesis of this enzyme and increase the structure. Two things. I mean, this is really pretty impressive. So when this enzyme is known to go up and down, depending on circumstances, even in the case of humans and obviously rats too. But the high protein diet is the second way that the high protein diet was doing it. It was increasing the activity of that enzyme. So it increases the rate at which the chemical comes into the cell, and then it increases the enzyme activity that metabolizes it to cause this damage. And that's what I'm showing here in the white at the top. And then it increases the synthesis. That's more enzyme. It also, the high protein diet increases the structure of the enzyme, so its activity changed. But it changed in a way, it did the same thing. It just increased the rate with the chemical carcinogen actually, would increase and then would bind to the DNA. So we measured directly what effect does a high protein diet have to do with the ability of the carcinogen to bind to the gene, to the DNA, if you will, or cause a mutation. It turned out, we did that particular study, we found that the high protein diet increased the binding of the carcinogen to the DNA. So we're in business. The cells are now mutated. Certain cells can now want to grow to cancer. But, in our bodies, we have a normal procedures. We have more than one, but we have procedures to keep this under control. One of those mechanisms for keeping it under control is called DNA repair. It's a rather complicated process. I don't want to get into the details of that. But lo and behold, the high animal protein diet, this is a good thing. We got this DNA repair. The high animal protein diet decreased that repair. So it was decreasing the ability of the cell to take care of its problem. So we got a bunch of so-called mechanisms just in the first stage here. Okay, I'm going to repeat that down below. There's the same scheme again. And as you can see that there's these three stages: initiation, promotion, progression. And we already learned from our earlier studies that I just showed you that we can turn cancer on and off during this stage. This in the case of humans could be not just months, but maybe years during the time when the cancer is beginning to grow. And it could go both ways, on and off. So we look for a mechanism there too, to see if we might find something, we can get a drug for, if you will. That was the thinking of the day. And again, I've got listed below some mechanisms. The ones in white are all increased. The one in the left they're all increased. The good one is there is actually decreased. So see the same thing again. Natural killer cells, in those days, the early days of this research, it was at that time just called natural killer cells. These days it's called T cells. And they've been trying to do research on that for controlling the COVID-19 flu-like symptom. But in any case, we were able in those early days to measure natural killer cell activity as a function of high protein feeding. So the animals that were consuming a high animal protein and getting more cancer and doing it really quickly, it turned out it was actually turning off the one mechanism that we have that's good, natural killer cells, also called T cells in modern day. Trying to do all kinds of research right now with respect to the viral infection we've recently had. But in any case, a high animal protein diet decreases the ability of the animal to get rid of the cancer cells, these early cancer cells. And I showed that decrease. Okay, it's good. Let's turn it off. And so the high protein diet is increasing all these mechanisms here, and now it's turning off to decrease the two things we got going for us, if you will. It's just compromising that. So then we kept on looking. Just over some period of 10 to 15 years ago, it's actually different students doing different PhD dissertations. But in any case, the high animal protein increased the rate at which these cells divide. That's not a good idea. If you got some infant, let's say early cancer cells, you don't want to increase the rate at which they divide because it's just growing the cancers, really. But we looked at that specifically, and we found that the high animal protein diet increases the rate in which these cells replicate. In other words, the cancer is now growing. It's been initiated here, these cancer cells are now growing with a high animal protein diet. Then we come on to another one, which in those days was kind of in the new stage, new ages of looking at this kind of thing. There's so-called oxygen-free radicals that are formed during the cancer process. They're an indication of the cancer being present. It's like a lab test in a way. But in any case, they promote the development of cancer. So we looked at the effect of animal protein on the production of free radicals, oxygen-free radicals. Lo and behold, I mean, these are cancerous. They're only stimulating cancer growth. And the high animal protein increased those too. And then, lo and behold, that's not enough. The high animal protein is increasing a hormone, insulin-like growth factor, which is associated with, was known at the time, it's associated with the growth of cancer cells and other cells. We have it in our system. Insulin-like growth factor, okay? Sometimes you just call it growth factor. So the high animal protein increases the growth factor, which causes these cells to grow and divide faster and faster. One more mechanism. And then that's what I have here. See, it's more complicated. I can't explain it here in one slide. It really has to wait. What high animal protein diet does to the use of calories, total calories. It's somewhat complicated, but we studied that and found that the high animal protein altered the way in which calories are used for promoting the growth of cancer. So we got lower. So now take a look at these. This is two representations of the same sort of process: initiation, promotion, progression, and we found a bunch of so-called mechanisms, or candidate mechanisms, let's call them, initiation phase, and then candidate mechanism, second phase. And it turned out there's a high animal protein diet in every case when it changed one of these really important so-called mechanisms, that's what we call them. It changed them. It changed them. And all 10 that we looked at, and there were actually more than that. In every case, the high animal protein changed everything that could put its hands on, so to speak, and get more or less the same result. I've got a problem here with my slide. So to summarize, the high animal protein increased the activity of these mechanisms. That meant more cancer. Each one, is a different test, different dissertation, actually, a lot of work. There's an increased 8 of them that actually caused faster cancer growth, and it decreased 2 of them. Well, that resulted in the same effect, because these 2 mechanisms here are the ones that should be working well. That's what the body has for its defense. And so the high animal protein diet is compromising the body's ability to take care of its own problems. So the high animal protein diet is doing all of these, and no exceptions. This is a really important point. No exceptions. So we got here 10 total mechanisms we examined independently. I didn't expect to see anything other than the fact that the high animal protein, I would have thought that wouldn't have any effect on cancer. But in any case, all 10 of these result in the same activity. It increased the propensity to form cancer. So the consuming more animal protein in this particular model, it changes some things. It changes enzymes. It changes the rate of this and that. It turns out every single one of these mechanisms, when they're studied in some detail, every one of them did the same thing. They all led to the same result. That is, animal protein increases cancer, period. In this case, the high animal protein was the protein of cow's milk. So all 10, and they did it essentially in unison, very rapidly. I mean, this is pretty remarkable idea. The question then becomes, which mechanism do we develop a drug for? Doesn't make sense, but this is fundamental to the entire, I say, medical research community, unfortunately. When we see something we want to control, we go to find something. We look at a mechanism. Maybe it's been 2 or 3 or 5 or even 10 years of trying to understand the mechanism. And then we try to find a drug to block that mechanism as if it's working all by itself. But it doesn't make sense. because here the high animal protein is everything is getting its hands on. It changed these different mechanisms, uh, all in a direction that only increased cancer, which we already saw just simply by measuring the amount of cancer that was actually, visibly present. So the question then to be asked, incidentally, at that time I was qualified and I was in the professional community of pharmacology research, so I was very much influenced by them as well as the nutrition community. But in any case, the question arises, which one of these mechanisms here do we attack? Which ones do we make a drug for? So we can sell it and take care of cancer in the case of humans. I couldn't conclude that was possible, because if you just stop one, okay, you stop that, but that's not necessarily going to necessarily change it a bit, but this makes really makes no sense. The high animal protein does make sense because it causes changes in all of them together in unison. Now, one of the things about consuming the high animal protein diet I'm showing here is this idea that in just normal everyday processes, as we increase animal food consumption, we decrease plant food consumption. We tend to eat for calories, not need as much food as we want, and according to calorie intake, satisfy our calorie interests. But as in normal circumstances, as we increase one group of foods, the animal foods, we decrease plant foods and some other things too. But these two here change inversely with respect to each other. And what we found was we could see that each of these foods had multiple mechanisms involved. Plant food, that's good. It's got antioxidants and fibers and all kinds of things in it that are really very complex, of course. Zillions of different kinds of nutrients, but basically the nutrients in animal food increase cancer, the nutrients in plant food decrease cancer. And it's best indicated by how much animal protein we consume. Everybody thinks animal protein is very special. It's called high quality. That was established back in 1924, almost 100 years ago now. It's kind of silly research, but it was done to show that animal protein, the more that's consumed, the more is retained in the body, and that was thought to be a good thing. So we call it high quality. Well, all the animal foods have protein that's generally in the area of high quality. Protein is in plant foods too, but it doesn't do that. It does the opposite. So this is really a striking concept, I think, in a sense. And this is both demonstrating that drug development doesn't make much sense when we're trying to sort of figure out, which mechanism we're going to do. But that's a place for a business and to tell the world that we've got the new cancer drug. That's why we have so many difficulties. I'll return to that later. But as we increase animal food, increase the rates for cancer and other diseases like this, we decrease plant foods, and they work together. As animal food goes up, it enhances the formation of cancer and related diseases like this. And as it goes up, the plant food goes down. It also causes these diseases to go up. So they work together. So now let me show you, moving on in some years, I was able finally to take advantage of some research that some others had done, several of whom were my colleagues other places. And I just wanted to show you their findings because they were, in this case, collecting data from a bunch of different countries and then plotting against, in this case, you can see here, this on kidney cancer, renal cancer. In this case here, they're plotting animal protein consumption in different countries versus the rate of kidney cancer on the x-axis. So here on the y-axis, on the y-axis, here in the x-axis, you can see is animal protein consumption, and measured directly that way. And you can see there's really a remarkably significant linear relationship with almost straight lines, almost from the point of zero, you go down to zero consumption of animal protein. In theory, you should suggest that we don't get cancer. So look at all these different countries that are abbreviated here. Sarusha Dawes at Oxford University, got a Bellhead, and in fact, he wrote for my book, a really fine gentleman, quite well known, a younger person in Australia at the time, Bruce Armstrong. But in any case, here's a whole bunch of different countries. Here's the US. We're up here near the top. As we increase animal protein consumption, we're getting nearly one of the highest rates of kidney cancer. Here's one published by another group. Mind you, I just went back. This was in the, when was it? This is part of my writing a China study, actually in the early 1990s. And so I found another study here. I've got references to all these. They had a plot here like this. This is heart disease mortality. In other words, same thing. This on the x-axis is the decile of protein intake, and number one, by the way, is the United States. And so as we increase the consumption of the animal protein diet, it does all this damage to, cancer, if you will. It's also associated with heart disease. Okay. Here's one for, these are all separate researchers. There's one on the West Coast. Was looking at the relationship between, what slides are getting in the way here, but in any case, it shows the relationship between non-fat milk and prostate cancer, of all things. Try to get some help with my computer. I can't seem to get it straightened out. It's blocking me. I'll pull it down. In any case, they're plotting non-fat milk. Okay, non-fat milk, that's skim milk. Okay, I know it very well. We produce a lot of skim milk on the farm as well. That it's there's no protein, very little protein in it, or less protein. And so what it turns out that they're supposed to be good stuff. What turns out as increase of consumption, as if non-fat milk, that's almost like a protein drink. The fat is not there, so it has no effect. As we increase the amount of non-fat milk consumption, that's the animal protein, we can see a really dramatic increase in prostate cancer. I actually gave a lecture on that to the Prostate Cancer Institute on the West Coast at that time. It's quite interesting. And you got to know the community fairly well. At the time, it was quite exciting, and people would talk about, skim milk, which we used to produce because it's supposed to be good, didn't have any fat. This is nonsense. So it turns out that it's really the animal protein in the milk, I think, that really causes the problem. So here's another one. Here's breast cancer. This is quite celebrated now. This is the fellow in Canada, friend of mine. We created seminars. But in any case, this is Ken Carroll and his group in the University of Canada. It was Ontario province, I guess. In any case, as you can see here, as the increase, as in this case, it's increasing. Who was it thinking at the time? People used to think that saturated fat is the cause of cancer. That's not true. Saturated fat, if you take it out, really has almost no effect like that. It's not chemically reactive. It's a thing that some of the beta vegetarian people talk about, but they really don't understand the nutrition of it. But it's a good indicator of breast cancer. So the higher the saturated fat intake amongst different countries, you can see the higher the breast cancer risk. And this is pretty well established now. That saturated fat comes from animal foods too, but it's not the agent that actually causes the cancer. It's rather inert. So in other words, it's a representation of protein intake, if you will. You can see all the different countries. US is near the top again, having one of the highest breast cancer rates of more animal protein-based foods. Now let's take another. Here's one about heart disease. The old story that we all know about. In this case here, the US is the highest. You can see up the right-hand corner. And here we got a different XY axis coordination problem, but nonetheless, as cholesterol intake is increased, cholesterol only is produced in animal foods. So this is a representation of animal protein intake, actually. Cholesterol it doesn't have that much effect that way. So as we increase, visibly, the cholesterol intake really is an increase in animal protein consumption, right? And the death rate of heart disease, really a remarkable straight line. See the US up near the right-hand side. So once again, now here there's a different disease. Again, it's a heart disease being increased as the ratio of animal protein containing foods, animal food, if you will, versus plant foods. There it is. So let's do some more here. Mind you, I gathered these charts. These are just gathered and took a picture of them and represent them the way they were actually published. Here's a case of colon cancer and of all things, meat consumption. This was done, I think it was with some researchers in Southeast Asia. But in any case, different countries. Here's the U.S. again at the top. As we're very high in animal protein consumption, and so they think there's something else about meat. It's the fat in the meat. It's not true. Like saturated fat, that's simply not true. So here's the U.S. way up here near the top. So all these slides are showing the same damn thing. Animal food consumed as what we do in the United States. Here's one for uterine cancer, like breast cancer. U.S. is really quite high. And again, this linear relationship. The higher the animal protein containing foods, regardless of what they measured at the time. These researchers didn't know what I'm telling you now, but it just turns out in retrospect, going back and looking at it. This is the comparison of animal protein containing foods or a ratio of that animal protein containing foods versus plant protein containing foods. That's where to do it. More breast cancer, more uterine cancer in this case. So it goes. So all these different charts that were published by others, now they went back and collected some years later, reinterpreted them. These are all animal protein surrogates. Cholesterol is meat, total fat, low fat, all these different things that people tended to think was really responsible. It really is not really compared to what really matters. These are all representations of eating the animal food itself, best explained by the fact it's about animal protein, which is related to lesser plant protein, like plant foods. And so it's a combination of that fact. As soon as we decide to eat animal foods, containing supposedly for the high quality protein, we're actually changing our diet pretty dramatically, and we're eating less of foods we should be consuming. So I talk about animal protein because that's where we did the original research. But in many ways, it's a kind of a ratio of animal to plant foods. And of course, this one here, I kind of started by the charts aren't very good. Getting blocked out. But anyhow, you can see for colon cancer, the greater the meat consumption, the greater the colon cancer risk. Here's breast cancer. Here in this case, my friend in Canada, he went and had a look at it. He wasn't thinking about what I'm saying here. He was thinking about saturated fat and unsaturated fat, but nonetheless, he did one where he looked at the relationship of these breast cancer with respect to plant food consumption, plant protein intake, if you will. No relationship. This, of course, is high because of this is animal protein. But in any case, so all these charts here, if you think of it in a more comprehensive way, the total diet, which can be characterized by the concentration of animal protein versus the concentration of plant protein. All these diseases kind of ran the gamut, and they all increased. So we see this correlation only for animal protein, not for plant protein. It increases cancers, it increases different kinds of cancer, prostate cancer, kidney cancer, colon cancer, and so forth, breast cancer, uterine cancer. So it's a total diet effect, really. Okay, let's move on. I'm kind of excited about what, in fact, was turning out because it was all really quite consistent, going from the lab, doing detailed studies, to population-based studies, and seeing the same thing. Here's another thing that bears on the question of what I'm talking about here. It really has to do with the share of the calories from animal protein versus GDP, gross domestic product per capita. It's fairly more recent in 2013. And you can see that as countries consume more and more money, if you will, they consume more and more animal protein. The amount of animal foods we tend to consume, and I think this is generally known by most people, the amount of animal protein or animal foods that we consume pretty much is a function of how much money we have to spend on that kind of food. More expensive. But so I just want to establish this relationship. It was published by someone else, showing that the relationship between here's GDP on the x-axis, and over here on the y-axis is the total amount of protein from animal protein. They share it this way, actually. This was done by for a group of countries, the Western kind of countries, as well as some others. Here's the U.S. right here, near the top. High income, more animal protein seems to go hand in hand. Hong Kong sort of does the same thing, the other way, and they're quite different from mainland China. Okay, so now we put the story together. Animal protein itself, and especially the kind of diet that it promotes, together with the amount of money we have to do what we do, means that we get more of these diseases. Now let me throw in another little curveball here to sort of elaborate on the medical system we now have. The pharmaceuticals that we use per capita is shown here. And it's a function as far as, I'm sorry, I apologize for this. I'm not showing the right kind of thing. Maybe you see it okay. I don't. There's 39 economic, Office of Economic Cooperation and Development, European countries especially. But in any case, what you see here, this is life expectancy. I'm sorry, this is your pharmaceuticals in terms of dollars per capita. We use the most drugs of any country in the world because we're getting all these diseases. We're eating the wrong food. The animal protein foods, less plant foods, of course, a combination, and then we spend lots of drugs. No wonder. That's what it is. And so we use the most drugs. And in the process of using the most drugs, that largely comes to the fact that we advertise drugs a lot on our TV. In fact, something like 70 to 75% from different estimates of the total ad budget on TVs that just go hands over fist over hands, I should say, and advertising drugs. They're actually supported by TVs, money comes from the TV industry. So our news stations, in a way, is promotion chambers for the drug industry. Only the United States and New Zealand permit TV ads from advertising drugs on TV. It's very sad. But I'll show you here what the consequence of all that is. We have the biggest ad budgets of all. I say 75% of the TV advertising in the United States is big pharma. And what do we get out of it? I would argue that it's a silly way of thinking about things. The drugs themselves are usually try to fixate on single causes. That's not the way the health works, but they just do it that way. And it turns out that according to some data that were published in the Journal of Medicine, is that the prescription drug side effects is the number 3 cause of death in the United States. So we have the most money, we spend the most money on advertising, selling drugs and all that. We use it. And then the drugs themselves, which, they use all those drugs, we get very poor results. And also, the drugs themselves with their side effects is the number 3 cause of death. Quite a spread between heart disease and cancer, diabetes, and so forth. But still, it's the number 3 cause of death, not inconsequential. Okay, now let me throw in one more wrinkle in the story here. This is life expectancy for a bunch of different countries. And what we see here This is life expectancy starting at 65. Okay, so we're just looking at this in later years. The U.S. is down on it. We're near the bottom. We use the most drugs, but we have the least life expectancy. I have to say, this information was known to me and others, and my wife and I changed the diet way back when she was in the late 40s and I was in my early 50s. I thought it was probably too late to make changes, but I'm now 91, she's 84, and today my colleague that's joined me in this session, Paul Esselstyn, a good friend of mine, he's done something really spectacular, sure I'm going to affect us of heart disease, but in any case, here's the U.S. life expectancy. We'll pay a price. Comment on that later. So quite remarkable. Incidentally, the Commonwealth Fund, very reputable, pretty established organization, they collected data on health, just recently concluded, as I have in the earlier book, that we have a really, really very bad health system. We're just loaded up with these diseases I've shown you here. We consume the most protein. We got the most money to buy the most protein. And so we're going the least bad food. So when you put that combination together in your head and you think about it, wait a minute. This evidence goes all the way from the laboratory in detail to population-based studies or intervention studies of various kinds. And it influences a variety of these chronic degenerative diseases. Without going into detail here, I can tell you we have a lot of data showing that what works for causing increases in prostate cancer or kidney disease or breast cancer, whatever, it all kind of hangs together. It mostly relates to the ratio of animal to plant-based food. It's not really in relation to saturated fat. Saturated fat, some people talk about that, but that's the chemistry is not behind it. Biochemistry, I should say. So let me summarize some things. So one thing in medicine, I'm just using that cryptic kind of word. Basically, the way we think about it is one disease, one cause, one mechanism. That's a big flaw we have in our thinking, in the public as well as the professions. We tend to think in a very myopic, what I call reductionist way. We always want to talk about one thing doing this or that or something else. Usually one chemical drug, if you will, affecting one mechanism. It doesn't make sense, affecting one disease. But that's the system, sadly, that we really have. These drugs are targeted, of course, for a certain endpoint, which is also kind of foolish too. And the side effects are common. And a big portion of my story is for my entire career since the 1970s, at least, I've learned that nutrition is not taught in medical schools. And there's a reason for it. And actually, the AMA, the American Medical Association, invited me to organize some talks for me in medical schools around the country. They did it for a bit, and I did it. I've spoken in medical schools in more than 40 states in the United States and more than 30 countries around the world. But in any case, it was the American Medical Association. Some folks in there, I didn't know that, had asked me to come and speak to, give seminars at medical schools, which I did. It's how I really learned a lot of this. It's all what was occurring in practice from sort of a 30,000-foot level. And nutrition is not taught because they think of one thing at a time. And it's always one, this nutrient, this chemical, get a drug, if you will, or this disease. I call it reductionism. It's very sad, but that's what our system is. And so we have a lot of the kind of diseases that would expect to occur because of that. And this is one of the reasons that the public is so confused about nutrition, because physicians are not taught nutrition. Their focus is on producing a product that is very targeted on drugs, fixed on a specific disease. It's not that they don't work, they do work. A lot of them will work, but unfortunately, it's not a lifestyle. It can work for a little while, maybe in some cases, but in terms of really trying to control the problems we now have, it's really kind of subtle. And this is the reason that the public is so confused about nutrition too. They haven't heard this before. So I'm going to summarize what I said here, if I can. I'm told a load of stuff here. It's too much, but here I just put some cap on it. I call it whole nutrition. I made that word up in the 1970s when I was on the Cancer Research Committee. I was at NIH for a while. My colleagues were all, of course, cancer specialists, and they were seeing some applications, wanted to study nutrition, wanted me to give a talk in nutrition to them. And at that time, I didn't want to go the vegetarian route because the representation of vegetarianism, a lot of people were talking about it, was not good science, very poor. They're leaning on saturated fat and stuff like this. But so I'm talking about it, in a more holistic way, total food. When I say total diet, I'm talking about one of the best indicators of a good diet, bad diet is the ratio of animal food to plant food. And of course, we dump a bunch of other junk along the way. These things that supposedly make it taste better, spices of herbs and this and that. We got problems there. But in any case, I'm summarizing here what I call holistic nutrition. I invented that word at the time. Use the other holistic. It controls, it has its effects through multiple nutrients working together, multiple mechanisms for each nutrient, multiple diseases, and multiple health improvement. And that's why I came up with that idea of whole food plant-based. Part of it derived from my presence on that committee at the time. But part of it also had to do with my being asked by the Federal Trade Commission to spend some 4 years doing testimony at the time. I was speaking medical school, so I ended up with a really rather sharp contrast between all what our work was showing, which is not about single things at a time. We do that in nutrition too. I lectured on this. We talked about individual nutrition, how much we should consume, what do they do, all that. I mean, it's really myopic. We're blinding ourselves for trying to go into these details. And so we do the same thing, and the nutrition community does the same thing, because we talk about one thing at a time, because that supports money, that supports revenue. That's the sort of bottom line. And then sometimes we make foreign compounds, synthetic compounds like drugs. They have side effects, even the nutrients themselves. That's just a nutrient here, nutrient there. Yeah, they can do some stuff in the short run. We can see some things on occasion, but that's not a lifestyle. That's not the way to run our lives. I'd rather think of it in this context here, from this perspective, that all these things here, when you think of them in the grand scheme of things, they really work together. Now, I've always talked about whole food plant-based, WFPB, but there's another element here I'd like to introduce that is somewhat different. It's a derivative of whole food. And it really has to do with this idea of multiple factor causation. We tend to think of, we got a health problem of some sort, we call it a disease or whatever it is, and we go and we get chemicals. We try to use sometimes, single chemical supplements, which really don't work in my mind. Maybe short time, a little bit, but that's not the way to practice health. And the same thing with drugs, even worse, with single nutrients, single drugs. And so what really comes out of this whole story means this concept, what I think of as multiple factor causation. Multiple factor causation really admits to the presence, if you're using whole foods, and if they're plant-based, if you will, there's multiple factors. I'm talking about, when I say factor, I'm talking about the substance in the foods themselves, as well as the mechanisms by which they work, as well as the ratios that they have, and as well as the time that may change. And so when you think about it in that context, it's an infinitely complex system that's guided by certain principles. You don't eat animal food because you don't need the protein. It's just eat plant foods instead. And this idea of multiple factor causation is a word I'd like to introduce because we tend to think of single factor causation. We're always turning everything, this drug does this drug does that, this nutrient does this or that, whatever. And we've gotten ourselves in a huge fix in our country, in Western medicine. and that is that we tend to be very prescribed. We tend to prescribe things in a very narrow sense. Single chemicals. Always look for single chemicals to solve some problem. When really that's not the way it works. If you look at the data expansively, collectively, where whole foods are being consumed, the more they are toward a plant-based diet, we see a variety of less animal food. We see a variety of diseases responding in a very favorable direction. So I call that multiple factor causation. And also, I'd like to point out that from all the evidence that I'm familiar with, and others, more than I do with this, but we've had 5 children, and it turns out that it's a good idea to keep in mind. This works for all ages. It's particularly important for older people. I'm 91 myself, and when we started, I didn't know what was going to come out of this, but with my father and heart disease, my wife said that I left her mother and cancer in her family for quite a number of years now. And I say the whole thing starts at children. And it's possible. That's when, from my understanding, it's a good place to do it. We've got the science to bear it, to support that suggestion, but also creating a habit for children to the point where, they're getting food they like, they become accustomed to it. They spend the rest of their lives doing it that way. The whole food they say that's where we should be going. Now, I want to finish off here with just a couple of ideas here. These have to do with public narrative, just generalizations. Here's one generalization that I find troubling. Basically, we tend to assess human health in our public conversations and in our private professions too. We tend to assess human health and disease and so forth too simply. And we oftentimes call it science. Well, I've been in science all my life. That's not science. That's just simply not science. It's using scientific words. Some of most people can pronounce correctly. Science has to do with the way we do things. So one of the benefits of the day was science means experimental testing, actually doing testing. You could do, if you're doing animal studies, you could do single things at a time, sometimes human studies like that. And you can do cohort studies, intervention studies with humans, population-based studies. And in any case, science means something, it's a very nice word. It's rigor. It should mean rigor. You're actually doing experimental testing of ideas. We're testing hypotheses. Maybe not believing them. You don't know what's going to be plus or minus, but the way to do that has been formalized that way very nicely by just controlling for our biases, especially our own biases. I learned this early on when I first got into universities, and I thought it was fantastic because when you control your own biases and you expose it to the examination by the public, professionals alike, as well as the public and professionals, expose your biases, it keeps you on track. It's a wonderful way of doing things. Use the science in a classic way that way. Just designed primarily for the purpose of determining truths and controlling for biases, especially in the case of experimental testing. So one more summary of this. This is one way we tend to think with these single factors. This is normal. We just think like that. And the way we do that is because it's pulled by money. If we can define single factors that might be cause or single diseases that might be a means of treatment, yes, we can get sometimes effects in the short run, but it's not the whole 9 yards. And much better way is just using as food. So it's just a simple linear pathway, which is popular, as opposed to plus fastway. Where in this case, stop and think about it. There are millions and billions, maybe trillions of factors. When I say factors, I'm talking about chemical entities. As I said, they may be nutritional, they may be foreign compound like drugs, and maybe this, that, something else, maybe chemicals we don't know about, but there's lots and lots of factors playing a role here. Always exchanging the composition as is needed. That's a factor that's really important. within a matter of seconds. The body, Mother Nature knows what the heck she's doing. And she can rearrange the cluster of factors that best address the causation of disease and, in fact, reverse it. So I think somehow we've got to find a way to be able to put this in everyday language that is obviously encompasses multiple factors. It's a very complex pathway. It's not linear like that, not a single line. If I could draw a scheme out, I haven't done that yet good, but it just branches out, and then we try to solve problems by going after one factor at a time. And try, as I say, sometimes we might get lucky and get a chemical that might do that, but that's not the way to go. It's not something to do it. Just doing the whole thing like Dr. Esselton, my colleague here on this panel, has done. It's just go for it and just change the diet in a way that my data show me the same thing. It's beautiful. So thank you very much. I hope this means something that's more, it's not exactly the kind of thing that's the take-home message, but the take-home message, I would say, for me, is it's quite good. It's just eating whole foods as much as possible. We don't need nutrient supplements, get them out of here. And just use the right kind of foods, stay with it, and then control health. And all the diseases that tend to become common in our lifetime. So thank you very much. I'll stop there and turn it over to my invite.
Hi, Colin. It's Michael. So first of all, amazing presentation as always. I really appreciate everything that you've done. The only author that I've read more of is J.K. No, sorry, from Harry Potter. That she has 7 books. I've read 4 of your books. So you're really a pleasure to read, and you explain things amazingly well. So I really appreciate that. For people who want to learn about your work, where would they go? Would they check out Cornell's website?
Yeah, it was labeled with Cornell, but now it's a private nonprofit. It's called Center for Nutrition Studies.
Center.
Center for Nutrition Studies.
Okay, great. Nutritious studies.
Yeah, CNS, Center for. Okay. Also got my name attached to it when we got together. At that time, I was just finishing up teaching a course for about 10 years at Cornell. Kind of challenging with challenging ideas. And then I retired. And then we organized this effort, with a nonprofit. Kept it going for quite a while. My daughter is the one that's heading it up right at the present time. But yeah, that's the one. My oldest son, Nelson, has also produced a couple of films. You may know about Forks Over Knives. There's another group that did that. And
yes.
It was very successful. And it was Dr. Esselton and myself, principally, and another fellow here on this program I know is a good friend of mine. But in any case, our oldest son made a couple of films, Plant Pure Nation. That's something that you might want to take a look at. Or the second one, Food for Freedom. Food for Freedom. That's lesser known, more recent. But just taking a group of people and giving us to have that for a while, short term, and see what happens. I have to tell you, and that those things, plus also the things that I've heard, with their advent of the emails and stuff like that, the number of the things I hear from people with all kinds of ailments, who they tried this and they just see this remarkable result. I know that's not a scientific analysis for sure, but I do know, on the other hand, that the breadth of this effect is pretty good. As I say, I'm 92, or 3 months younger than my colleague who's speaking on the same program, Esselton, but he and I and our wives are we do what we preach. And I'm 91 right now, and I'm kind of struggling through this talk, but whatever it means, I don't know.
Yeah, you did a great job. And actually, Forks Over Knives is the documentary that introduced the whole food plant-based diet to me and got me obsessed with learning about this stuff. So I thank you. I thank you very much for that. So a lot, a lot of amazing stuff that you shared. Um, and you've done such a great job of explaining the various mechanisms for how this all works. Why, given that I mean, one, it's reproducible in the labs. You showed one slide where you had someone reproduce the research that you did on the rats with aflatoxin, and I believe that your research was actually a replication of somebody else's in India, if I'm correct. And why do you think that this stuff in the scientific community, and you kind of hit on it a little bit, isn't resonating? Like why, it is reproducible. You can show this stuff from a deeply scientific perspective. Why doesn't the scientific community, at the very least,
That's a really, that's a really good question. I might preface this though by a comment on the Indian work. At the time I learned about it, they did not believe their own results. And so they went back and did another study, redesigned it in a way in which they claimed that it didn't work. It was the opposite way. They didn't do it right. And so I've always had to address that question. So the Indian work was, bold in the sense that we did it at the time, trying to find out what's going on. But that was back in, in the 1960s, quite a long time ago. But they didn't believe it and they moved on. But now come back to your question. Why don't people get to know this? I'm asking myself that question all the time and trying to figure out ways of saying it. And because it really works. There's so many people we know that, you eat this way, just having a longer life is kind of nice, I guess. Like some other things to go along with it, but nonetheless, that I think that the issue really has to do with the animal protein argument. That's a very sensitive, politically sensitive, economically sensitive issue, and that's how I learned it. And so I have to tell the story the way I learned it. I didn't believe this stuff myself, for in the beginning. Animal protein doing this kind of stuff didn't make sense to me. And that's why I got so much involved. I got NIH funding, and throughout my 30-year active career, I was funded extensively by National Institutes of Health, National Cancer Institute, and American Cancer Society. So I had to defend what I was doing, by going to these organizations where you can actually get really critical professional review of this stuff. But in the public, to go to the public, the discussion we have, the narrative we have in our public is don't question animal protein. I know the story so well. I know what they've been trying to do to me, but that's a very sensitive topic. I mean, you got people believing that animal protein is the number one nutrient. What's wrong with that? I mean, we've been around that barn for a long time. And I found it really difficult myself, but there it was there. And in my mind, sorry about that. In my mind, the whole thing was, sorry, I just got a call here. Got to stop this here. Okay. All right, I can't, sorry, what do you do with phones? Like that. Okay, I'll try to. Oh, yeah, hold it, Leanne. Leanne, I'm here giving a talk. I'll be right with you. Sorry. Okay, there we go. This modern age is different.
I know.
It's really different. So anyhow, to go back to your question, really, that is the question. I really think it's the hostility that comes from, in my case, two professions. One from my own profession, nutrition, where they worship animal protein. And the history of that story is so fascinating. It goes way back, the early 1800s, late 1700s. In fact, it turns out my great-great-grandfather was the one who advanced some of the initial stories on this. I learned belatedly. I didn't know this, but his name was McElwain, and my father's middle name is named after him. Our youngest son, who's a physician himself, his name is McElwain. Thomas McElwain. And so I'm quite familiar with the history, and I spent some time trying to learn what I could about it. it's really a fascinating story. Why did we do what we did? Why did we end up with a medical system that focused on the use of drugs and not try to work with the idea of nutrition? Well, they don't teach, for one thing, the medical schools don't teach nutrition, and there's a reason they don't. So physicians, they're not in the nutrition area, and they tend to want to say things that are very reductionist. They're talking about a drug for this, drug for that, just this disease, not that disease, kind of thing. And I don't like the reductionist model, partly because our own research obviously showed didn't make sense. So I think that the worship of animal protein, because of the agriculture community, I mean that's pretty big in the world. And now we got lots of evidence on the effect of the agriculture community, on environmental problems we have. And that's a big issue too. If we just start eating the right food, we can go a long ways to really solving that problem too.
I would suggest to the audience that if you do want to learn more of Colin's thoughts on this, your latest book, The Future of Nutrition, goes and does a deep dive on and using cancer as the lens and how people have been basically erased from history. All this research has, there's been research going back over 100 years ago. And and even the founder of, I think, was it the American Cancer Society, was a statistician that was showing that animal products were problematic and or that it was a constitutional
Oh
effect.
yeah, you got the right word. Yeah,
Yeah.
that's right. Yeah,
Yes.
he was using it for cancer, describing the causes of cancer. But interesting, this is the beginning of the Industrial Revolution in the middle 1800s. And but he was arguing that the way we should understand cancer is the constitutional characteristics. That's multiple things working together, which I call holism. It's the same thing. And but with time, with the Industrial Revolution happening the way it did, with all the focus on making a business, I understand that. I'm a free market guy too. But when we can focus our efforts on making a little bit of resources, monetary resources, that's okay. We just got to find a different way to do it, a better way. I think I know some ways. And I wish I could wake up the public and my professional colleagues on the same ideas. But anyhow, that would be a long way off, I guess.
So now so who is following in your footsteps? Who else would you recommend that people, that people begin to follow if they're not following them already, that you believe are singing the same tune that you've been singing throughout your career?
Yeah, sure. That's a good question too. I mean, in my family and my friend Esselstyn's family, Rip Esselstyn is the oldest, but our oldest son was in economics. He made some films. That's Nelson Campbell. My daughter's the head of the Center for Nutrition Studies. So they can follow those two things there. I mean, obviously, the place that I enjoyed doing was looking at the scientific literature. But I'm in science, so there's lots of strange things there. I should tell this story here. Science I love science. The whole concept is a process by which we determine truth, and we control biases. And I find that concept is quite old, and we have to control our biases, especially our own. And I had a big one of where I came from. You control bias, you do it in a public way. And it's because always people want to get around it or this or that. We end up with a lot of arguments that are unnecessary. So I'm a big fan of science done correctly, where we convert opinions into facts. And I think in the case of the original question, so it's the influence of the animal industry, number one. Influence of the drug industry, number two. They're real, and I know it, I really know it well. And there's various ways of doing things so that one more thing, if I can say, I've written another book and just finished writing it. Summarizes some of the stuff. And
You just, Colin, you just went really quiet. Can you talk again? Because I can't hear you anymore.
I said, well, one more thing. I'm just now finishing another book, the last one. I'm not going to do
Okay.
the, and I'm trying to address the question what you just asked. You know, why is it so difficult? And so one thing I think is worth telling. I've got 10 listed. I've listed 10 episodes, I call them, that I've seen especially at the policy level, but also, you know, at the level the public doesn't tend to see, the kind of things that go on behind the scenes. You know, some of these things are quite sophisticated. Some are kind of, you know, silly, just ignorance, but whatever. There's been always been an effort to think of things very discreetly, one thing at a time kind of thing. And animal protein has been, as we already said, it's almost worshipped.
Uh,
Yeah,
what
so
what's the name of the book that's coming out?
oh, uh,
Hello?
the exact whole, the whole story, something like that. The whole.
Hello, Colin.
Oh,
Wait a
oh,
minute, trying to call me. Hey, hold on,
Hi, Colin.
yeah, I'm on
Hello?
a lecture right now and online. Call me later. Take like 15 minutes.
Okay, I'll give you a call later.
Okay.
Okay, bye-bye.
all right. So the name of the book you were talking about.
It's good. The whole truth is, I think, what we settled on.
I'm sorry, what is it? You cut
The
off for a
whole
second.
truth. The whole truth.
The Whole Truth. Okay, that sounds like a perfect title for one of your books, The Whole Truth. And so in your okay, so first of all, with regard to protein, um, you know, it seems that obviously people are eating way too much animal protein according to what you've written and spoken about. Can someone eat too much plant protein in its whole form? And what are your thoughts on a lot of people are you know, in the vegan space will take the, you know, like we'll take the isolated pea protein and put it in their smoothie and whatnot. What are your thoughts on that kind of protein?
Well, I don't think you can get too much plant protein, but I don't think it also is a very relevant concern because if we're just eating mostly plants, and that's what we do, a mixture of plants, you got all kinds of varieties of getting all kinds of other things along with it. Kind of stay with it. You know, it's tasty thanks to my wife, you know, who been feeding us, she and I for a long time, you know, 5 children, but nonetheless, I don't think you can do that. You know, we have protein supplements. I know that, but I'm not aware of using protein supplements to achieve something important that, you know, can do more than just the foods. There's something about the idea of using foods and a variety of foods, you know, and don't add back a lot of salt, sugar, and fat, stuff like that. You know, kind of stay away from that. Just use I call it whole food plant based WFPB. I coined that phrase way back in the 1970s when I had some colleagues in cancer research trying to get me to explain what was all about nutrition. Nutrition, that's the best I could come up with. It kind of stayed around. Whole
Yeah,
food
it's
plant.
stuck. It's stuck. So you do, you know, you talk about cholesterol in the future of nutrition, and you say that dietary and let me know if I'm getting anything that you say incorrect, that dietary cholesterol does not contribute to serum cholesterol. Is that a correct understanding of what you said? And can you explain that?
Yeah, sure. Some studies were done early on, not terribly well done. I can't argue for them, but nonetheless, there were some studies done back in the 30s, especially 1930s, 1940s, that cholesterol was first off was known to be associated with heart disease. Oh, you know, that's the answer. It was kind of simplistic answer, and so they said let's not eat so much cholesterol. That was that kind of simplistic thinking that I was talking about before, and so that has not done much of anything except that low cholesterol blood or serum is typically found in people who eat this way. And I forgot the first part of your question. I'm not sure.
Well, just in your book that you wrote about how dietary cholesterol does not contribute to serum cholesterol.
Yeah. Oh, yeah, yeah, yeah. I know some studies were done that way. My colleague Krachevsky, he now passed away, but I know he reviewed some of that, and it was we got dietary cholesterol one thing, but then we got high cholesterol. We got HDL cholesterol and LDL cholesterol is another thing. We got total cholesterol. So some of those studies were a little bit, confounded and confusing for a while. But just taking cholesterol stuff wasn't doing the job. It came to a point, and I think it's the wrong. I'm rather generalizing, wrong about the 1950s, early 60s, just when I was sort of starting my own career. And it finally got to a point that cholesterol was still the thing that was influencing people across the land. And they then decided, the pharmaceutical companies came along and said, well, let's knock this out. Let's get a drug and keep this low. So during the 1980s, late 1980s, they came up with a drug called statin, lovastatin, and they made different kinds of statins. And now it's proving that they're not really working what they thought they would. They're not doing the job. You got side effects of statins for one thing. They're not working very well, or they got side effects. I've read myself out of your question.
No, that's okay. So, I wanted to get to the next question on cholesterol, which is if dietary cholesterol doesn't contribute to serum cholesterol, should we be considered with our cholesterol number at all? Like, is cholesterol the cause of heart disease, or is it a benchmark for how much animal protein we're getting?
It's a latter. It's the latter. It's a reasonable, clinical benchmark, I think. But the thing is, we can almost forget about it because when people eat this way here, almost everybody, their cholesterol levels go down to very reasonably low levels. And it's a complicated arrangement. It was founded on the idea that, the cholesterol in the blood was a function of what we consumed, or it was founded on the concept of, eating a kind of diet or doing something like that to cause it to go up. But anyhow, it's I see somebody's pictures on the screen here.
Oh yeah, that's just our next speaker. He'll be coming up next.
Hey,
Okay.
Colin, how are you?
That's Doug Evans.
Okay.
Hey, Colin, are you sprouting? You eat sprouts?
Do we have sprouts?
Yeah, do you ever grow sprouts?
Yeah, we do some of that. Yeah.
It's interesting, Colin. I lived exclusively on sprouts.
You did.
30 days. I ate 100% whole sprouts. Alfalfa, radish, clover, broccoli, lentil, green pea, mung beans. And I was getting about 3,000 calories a day of sprouts. And my life just exploded with energy, with vitality, with magnificent poops. I couldn't believe it.
See, he Doug just answered my question better than I did. There's just proof of the pudding right there.
Yeah,
That's amazing. Yeah.
Yeah, 2 or 3 good poops a day. It was really extraordinary. But it's interesting, Colin, in a way, I feel that sprouts have been overlooked because there wasn't a big business opportunity in the United States. That sprouts had a short shelf life and low margin, and they required refrigerated distribution. So there were no major sprouting companies, no national or international sprouting companies. So there was no business. And the business of food is all about canning and additives and preservatives and artificial colorings and long shelf life. And since sprouts had a short shelf life, there was no business. So I spent, in 2022, I researched foodborne illness in America. and I looked at all of the cases over a quarter century, and I rationalized all the data. And what it got to was that sprouts had about 10 cases of illness per million. Lettuce was 20 per million. Chicken was 850 cases per million. And because everyone's eating chicken, it's not even newsworthy when someone gets sick from eating chicken. So I felt that sprouts were unfairly demonized. And then when I moved into the Mojave Desert by Joshua Tree, it was both an environmental desert and a food desert. So I had no access to food, and I didn't know how to grow anything, but I knew about sprouts. So I asked my creator, I asked the universe, I said, how can I be healthy? How can I live a plant-based diet, a whole food plant-based diet? And the universe said, Doug, you know how to sprout. And I was like, no, sprouts are a garnish. They're a side dish. And because I had nothing else on my plate, I started to fill. And within 1 cubic foot, with 6 glass jars, I was growing thousands of calories a day and totally self-sufficient, autonomous, and sovereign from growing sprouts.
That's quite a story. Quite a story.
Yeah.
But that obviously we're in the same space. You and I.
Yeah, well, I love your work, Colin. We spoke a long time ago, and you were a great influence for me, and all of the reductionists and all the people that are promoting these crazy diets. And you were the sanity for me. And I took the E. Cornell course, and I learned so much, and you influenced me that I realized, and this is an insight which I love speaking to you, where I'm connecting the dots, is that every single sprout contains every single amino acid to form complete proteins. And some have more than others. So if you were to combine lentil sprouts with broccoli sprouts, you actually boost all the profiles to get something that's even more rich and complete. But we don't need to think about individuals. We just need to make sure we're getting diversity of nutrition from plants, and we're getting sufficient caloric intake, and then we don't have to worry about anything else. So that's what gave me the confidence, Colin, to actually do what I was doing. And I did it for 30 days until someone, I went to town and someone offered me an apple. And I was like, okay, I'll eat an apple. I'll eat some watermelon. But now my diet is 50% sprouts and 50% fruit. And the other thing I learned from you,
Doug, I just want to wrap up with Colin. We just have a couple minutes, and then we'll.
Oh yeah, please. Are we live now, Michael?
We are live. Yes.
Oh wow, I had no idea. I thought we were just kibitzing in the.
Oh no,
room.
not at all. No. So let me wrap up with Colin. I had one more question for him that I want to get to, and then the audience is already excited to hear what you have to say. So I appreciate that, Doug, and I appreciate your infectious energy. All right, awesome. All right, great. So, John, if you could just turn the screen, thanks. So, Colin, we just have time for one more question that I wanted to get to, which is, maybe even more, but has there been any research where they have tested just cholesterol, giving someone cholesterol to raise their serum level, if that's possible, without animal protein, to see if that increases heart disease or any other issues?
I can't answer that, versus chapter on that kind of thing, but there's been some of that kind of research, at least according to my recollection, that was done in those days. I'm sure it wasn't very rigorous, but I do recall that there was some research like that, but I'm sorry I can't offer you more detail on that. But
No, that's
they
totally.
they did enough. They did enough to conclude. They did. Yes. And so I certainly did later and have the chance to go back and have a look at it.
Okay. And I'm going to try to fit one more question in here. So we had a speaker yesterday who was talking about flax oil, and he has a flax oil that has more omega-3 fatty acids in it than omega-6s, right? Because there's a big imbalance. What are your thoughts on oil? And if you had flax oil with this, higher ratio of omega-3s to omega-6s, given the imbalance that most people have in their diet, do you think that would be good for somebody? What are your thoughts?
Yeah, well, I'm thinking about it in the context of whole food, of course. I don't know, taking a pill with just omega-3s by themselves or without the six or what, I'm not too fond of that idea. That's kind of strained for the whole food idea. But the omega-3, the ratio is what matters, as I'm sure you know, both in what we consume as well as in what we actually end up seeing in the body. The omega-3s is the good stuff. The omega-6 is questionable. But the ratio is really quite critical. And total fat too. Shouldn't go too high.
All right, awesome. Well, Colin, it was an absolute pleasure to learn from you once again. Really appreciate your contribution to everything, and in general, and for me personally, you've had a huge impact on my life choices. So it definitely has resonated with people. Just so you can, I'm sure you do get that plenty, but it really has. And I continue to follow your work, and I'm excited for the next book that you have coming out, and I will definitely read it. And we hope to see you next year, and we could talk about the book if it's out in time for next year's conference.
Okay. Well, thanks so
Okay.
much.
Thank you. We can unmute the audience real quickly.
Most of the day, so
Thank you.
Oh, that was awesome.
yeah.
Thank you so much.
Thank you.
You're the best.
Yay, yay.
Hey, thank you.